Hi, everyone. Welcome back to this episode of HR Unplugged. We are very happy to have you with us again today. I have been joined by Alhassan Elbarasse, and he is our Senior Vice President of Total Rewards. He has been with Maximus for 6 years, has a long career in HR, and he does everything related to comp, benefits, wellness, plus a bunch of other stuff for us. But I intend to tap into his expertise today on a number of subjects. And so welcome, and let's get started.
Thank you, Michelle.
All right. So my first question for you is, with a lot of companies doing what Maximus is doing and moving more towards skill-based hiring, what are you seeing like the impact to be on like the comp department or compensation practices in general with skill-based work?
Well, it's an excellent question and absolutely timely right now. We are seeing compensation evolve now into paying employees for the knowledge, skills, and competencies that they have as opposed to the jobs that they do. If you think about the hiring process, it is totally trying to put an employee or a candidate into a slot and get them to fit into an existing job and a spot in our compensation structure, whether it's a band or a zone. Those bookends at either end of the salary structure tend to limit the employee and what they can do. And if you think about it, if we're looking at, if you have a home and you're want some tasks done at home, you want a painter, you want to paint your walls, you're going to hire a painter. If you want drywall done, you're going to hire a drywall person. That's what the current job market looks like and compensation looks like. We are hiring specific roles as people to fill those specific roles. But if you're having a major project done, you want somebody who can do more than just one task. And we're looking at employees and our current workforce and saying, imagine if Michelle could do something else.
Be the general contractor.
Exactly. So that really puts employees front and center. It actually compensates them more accurately and more specific. No longer are we trying to fit a square peg into a circle hole. We are trying to customize the experience, the compensation, the rewards package for that employee, and the skills, knowledge, and competencies that they bring to the job. So breaking down jobs into skills is going to require breaking down compensation into the different tasks and paying people accurately for that. It works out for the employee because we definitely want people to do more than one task. So we're going to help them gain new skills and be more valuable to us, be more valuable to themselves and to the market in general.
That's great. Do you think a part of the conversion that will be more complicated is actually helping managers understand that?
Absolutely. The hiring process, the interview process, the management process has to change. No longer are you, like I said before, trying to get people to conform, but everything's going to be actually specific and customized to that employee, their own career aspirations, where they are in their skills today. Managers are going to have a much more intimate relationship and understand what skills, competencies the employee brings to the table, and then how to get them ahead and then get them to gain new skills. So it's no longer going to be a one-way conversation, but it's going to be a dialogue.
It's funny for me because I think that when I think about one of the biggest disconnects that exist in like the current compensation environment and not where it's heading, but where it has historically been, is there's what the market pays, and then there's where leaders see value. Right? Like, in other words, I've had this happen a couple times throughout my career where, like, the head of corporate real estate, for example, is a job. And it's market priced a certain way because that's how the market pays the position. And yet, like, you'll have a CEO who's like, yeah, but they just built our new building, or they've just done these amazing things. We really need to, like, they should be paid a much higher. And they assign a value in their head to that job up against other jobs, but it's not necessarily reflective of how the market sees things. I feel like now with going to a skill set, like you're almost aligning closer with what managers ultimately want, which is paying for the value that's inherently real in the job. But it also is a mindset shift for them, right? Like, hey, wait a minute, I might value this more, like this particular skill more, but that doesn't necessarily mean we pay more for it.
Exactly. So right now, through most salary structures, the proficiency in the job is what's measured. In the future, when we have a skills-based compensation system, the proficiency in that specific skill, and more importantly, adding adjacent skills to that role or even impact, you can have the flexibility to align the compensation with the corporate objectives at the time. That is hard today with our rigid salary structure and the way that most companies pay today.
I don't know yet how we're going to get finance on board. They're
Yeah.
so used to it.
Well,
In every organization, right? Like, salary line items are your most expensive line items. And so, they like some degree of stability there. And if people are upskilling and grabbing onto new skills, like, I won't make you comment on it, but I can only imagine how our finance folks will go, what do we do with this?
Well, the trick is to put them first on the skills-based compensation.
That's very
because
smart.
absolutely, they bring more than just what a typical finance person brings to the table, and they're faced with challenges that are not typical and not in market data. So absolutely, we can put finance first.
That's the way to do it. That's great. All right. My next question for you is, a lot of companies have stepped up their wellness benefits. We have too. I feel like, we have an entire slide deck dedicated to all the different wellness offerings that your team has put on the planet. I mean, you have such a great team. They've done such a good job of offering programming. But how do we bring the horse to the water, and make sure continuously that people are aware of it, taking advantage, are using what is there?
Yeah, you've touched on my proudest achievement here at Maximus. It really is getting that wellness program from the simple benefit fairs or tchotchkes that we would give away to something clinical, something that's actually results-based and activity-based. What we have been successful with, and Liz Olson is absolutely the tip of the spear on this initiative, but is meeting employees where they are. Whether it's digital first, which is our biggest requirement for any of our new partners or vendors, is I want employees to be able to access their healthcare or start their wellness journey not in a waiting room, not in an exam room with a doctor that they've met for the first time, but in the comfort of their own home or wherever they are, and be able to engage and meet them where they are. Not only that, but meet them where they are on their wellness journey. Not everybody's starting at the same place. Starting from a beginning point like that really grabs more employees, and it absolutely we need to understand that wellness means different things to different people.
It is unfortunate how many people wait for a health crisis to focus on their own health and wellness. And I say to everyone who asks, we all have a doctor for our body. You should have a doctor for your head. I mean, emotional wellness and well-being are just as important. And I feel like employees, I think you're right. If it's digital first and they're in the comfort of their home, they're more likely to tap into it. But I still worry that, they're accessing it too late.
And prevention is key, and that's their relationship with a primary care provider. We have pushed that as much as we can, but we're realizing employees just don't have the time off. They don't have the availability, or doctors don't have the scheduling time to be able to meet people. So what we are doing, and we're pushing all of our contracting relationships with Anthem to push doctors to have Saturday hours, to have after hours, to have virtual capability with their patients, to be able to catch those things early. Now we offer free labs to all of our enrolled employees through Quest Diagnostics, and regardless of who we provide it with, it is an opportunity for you to schedule your lab, go in, get your results, and speak to a nurse. Those things help you catch your conditions early. Prevention, screenings, all those things play into it, but really it's how do we engage those employees and get them to start thinking about that. And that absolutely is three words: removing the barriers. Whether it's a scheduling, whether it's cost, Maximus has done tremendous things to be able to remove those barriers for people to start their wellness journey or continue it.
That's great. That's great. I also, the free telehealth is a game changer, right? It's one of the best things we do. That free telehealth means you have no excuse for not contacting the doctor and or, whether mind or body, it's there for you. So that's great. All right. This one I feel like is one that you and I talk about quite a bit, but where do you see medical and benefits trends heading? What should folks know about what's coming down the pike?
If you watch the news, you'll see that the retailification of healthcare is happening with players like Amazon, Walmart, and CVS meeting and curating experiences for customers as opposed to requiring you to conform to a doctor's office or a doctor's visit. The number of urgent cares that are popping up, the number of minute clinics that are everywhere now, Amazon getting into One Medical, Walmart jumping in as well. They're meeting clients and they're meeting patients where they are, and that really is a sign that not only is it profitable for them, but actually it is more convenient for employees and convenient for patients to access healthcare. The second thing is big data. We have in the United States a ton of health data. All of these carriers, all of these hospital associations and providers have tons of health data, and we haven't really done anything with it. Mainly because it's residing in different places. But one of the big pushes for electronic health records is to be able to have everything in one spot. Imagine on your phone or on a website, you being able to share that information with a minute clinic, the same way that you'd share it at an urgent care, at a doctor's visit. And we've seen, especially since COVID, with the vaccination records, there is a huge push to get those records available to you and at your fingertips. My wife's doctor just retired and handed her a stack this thick of her medical records and said, "Take it to your next doctor." And she said, "This is crazy. I can't believe they haven't scanned these yet or provided it to me." But that's the old way of thinking. And we're really seeing that they're going to use this data to help curate your experience, whether it's at a retail establishment or at a provider of your choice.
I was hoping you were going to say that we were all going to get our own personal Bayamax that just walked around, making sure our health was good.
I wish. I'm pretty sure Apple's working on that for the next thing, but
that's true. My Apple Watch is probably as close as you come to a Bayamax of today. That's great. You and I talk a lot about the GLP-1s and, the expense of carrying those versus a bariatric surgery, but also the trend that you and I have been talking about lately is the fact that people are starting the program and dropping it before it's had time to work, and companies are starting to be concerned about the cost of those medications. Where do you see all that heading?
Really, I think as a new product comes to market and definitely gets adopted by patients and by employees, you'll see an uptick because absolutely they are spending their money on advertising dollars and their marketing to get people on them. Once we start seeing results, I think people will start understanding that this is not only just an injection that you have to do, but actually a lifestyle change. What we're going to see and what we're seeing from our partners is a more not monitored, but more curated experience through GLP-1. So if you are on one of these drugs, whether for diabetes or weight loss, really having the advice and monitoring of a doctor to be able to be with you through the whole process. It does not mean we're going to put in more restrictions, or we just want to make sure you're doing it for the right reason. You have the right monitoring, because there are some drastic changes that are happening to people who are on these drugs. They're not eating right or they're not exercising. It all comes together, and it has to be one big bundle of package or of experiences.
That's great. So my last question for you, one of my favorite things about you is your focus on development. And you are so brave and always saying, hey, what do I need to further develop? What do I need to do? Or, do you have suggestions if I want to head here with my career? I think about that and, it's so meaningful, but how do you convey to others sort of that importance of focusing on your own development and convey that sense of, if you don't push this, no one will push it for you?
Yeah. I mean, it's one simple rule that I tell my team and I tell anybody who asks is, if you come to Maximus or if you leave Maximus with the same set of skills that you had when you arrived, we failed you. Right. You really owe yourself, and we owe to employees, to be able to develop and gain something new. This is not going to be the last thing that you do. This is not the last job title that you will have. And it is imperative that you tell me what you want to do in your career, and it's my responsibility as soon as that I hear that to make it happen. Whether it's an opportunity, experience, getting you in front of somebody, connecting you with somebody, or paying for training or reimbursing you for tuition that gets you there. And we have had tremendous, tremendous positive feedback from employees. From my own team, not everybody wants to do benefits or compensation or wellness for the rest of their career. And I tell them, you want to do compensation? If you're a wellness person today, I will get you the opportunities to do that. I asked you that question, and you really, it was a humbling experience. And you said you do great at your job, and I always thought my growth would come in from the area, my comfort zone. And you said you really need to learn how people learn. And I am wired a certain way, and I never thought about that at all. And I just thought people just didn't get things because they didn't get them. And you explained to me, if you become a facilitator, choose one of these programs that we offer, you will actually see, and it'll open your eyes to how people learn. And I embarked on this humbling journey of becoming a facilitator for Insights Discovery, and it's eye-opening.
That's awesome.
Yeah, I really enjoy it, and understanding that some people are visual learners, audio learners, some are readers like myself, but really that's my development, is I need to understand how people learn, and thank you for making that happen.
Well, and just say, you do get great scores on your facilitation skills, so
Good.
thank you.
Thank you, Phil.
All right. Well,